South Africa, a country celebrated for its diversity, resilience, and the hard-won freedoms of its democratic transition, is today facing a crisis that exposes deep fractures in its society. This is a story not just about hospitals and clinics, but about belonging, human rights, and the identity of a nation. At the center of this crisis is Operation Dudullah, an anti-immigrant movement that has taken it upon itself to block foreign nationals from accessing public healthcare facilities. Their members conduct unlawful ID checks at clinics, force patients to leave waiting rooms, and intimidate healthcare workers into compliance. The group argues that state-funded healthcare should be reserved exclusively for South Africans, yet their actions fly in the face of the country's constitution, which explicitly guarantees that everyone, regardless of nationality, has the right to healthcare. The consequences of Dudullah's actions are devastating. Many of those turned away are among the most vulnerable. People living with HIV, tuberculosis, and diabetes who require continuous treatment, pregnant women needing antenatal care, and mothers bringing infants for vaccinations. Denying them care is not just an act of cruelty, but a public health risk with the potential to destabilize entire communities. Doctors Without Borders has sounded the alarm, warning of an impending health catastrophe if this continues unchecked. The fear is palpable among immigrants who have made South Africa their home. Some have lived here for decades, raised children, contributed to local economies, and formed community ties, only to now be treated as outsiders at the clinic doors. One Mozambican mother refused entry after presenting her passport, worried aloud about her child missing vital immunizations, an example of the human toll behind Dudullah's rhetoric. The group's justification rests on a narrative that immigrants strain South Africa's already fragile healthcare system. It is true that public hospitals are overstretched, underfunded, and facing immense pressure. But blaming immigrants ignores deeper structural issues. Years of corruption, mismanagement, and budget cuts have left the system buckling under the weight of demand. Dudullah exploits this frustration, turning it against foreigners who become easy scapegoats. Their rise is tied to South Africa's broader socioeconomic challenges. Record high unemployment, especially among the youth, poverty that breeds resentment, and political disillusionment that leaves citizens searching for answers. Instead of demanding accountability from government leaders, Dudullah directs anger toward immigrants, presenting itself as a grassroots movement, saving the country. Inside hospitals, Dudullah's presence creates a climate of fear. In places like Katlehong, east of Johannesburg, vigilantes have set up informal checkpoints outside clinics. They demand ID documents from anyone attempting to enter, denying access to those who cannot produce South African papers. Patients are left humiliated, scared, and sick. In one case, 3 Dudullah members were arrested for these actions, but the group insists it will not stop. Their influence is growing, and they have vowed to expand beyond healthcare, even announcing plans to target immigrant children in state-funded schools by 2026. This creeping agenda transforms Dudullah from a vigilante movement into a political force, aiming to reshape policy itself. The government's response has been mixed. Officials like Foster Mohale, spokesperson for the Department of Health, emphasize that interfering with healthcare access is illegal and must be reported to police immediately. They insist that these incidents are isolated, limited to certain facilities in Gauteng and KwaZulu-Natal. Yet rights groups point out that police often fail to intervene, with some officers even standing by as Dudullah conducts unlawful screenings. Doctors Without Borders has documented cases where healthcare workers and security staff tacitly colluded with Dudullah members, raising serious concerns about discrimination within the system itself. Mohale rejects these claims, arguing that healthcare workers take a Hippocratic oath and cannot discriminate. But he also calls on anyone with evidence to bring it forward. Still, many observers note the government's defensiveness, interpreting it as a reluctance or inability to fully confront Dudullah's growing influence. For ordinary South Africans, the issue is deeply divisive. Some citizens sympathize with Dudullah, believing immigrants put unsustainable pressure on public services. Others condemn the movement, recognizing the humanity of patients denied life-saving treatment. A South African citizen at one clinic expressed concern. Some people are really sick and they don't have money. They need help. So what will happen if someone dies there? This tension reflects broader debates about what it means to be South African and whether the country's values, equality,